asking questions in different languages. We were only missing Spanish. We hope that will come next time.
We have spoken previously about the factors countries must consider as they plan to start lifting the so-called lockdown restrictions. We want to re-emphasize that easing restrictions is not the end of epidemic in any country. Ending the epidemic will require a sustained effort on the part of individuals, communities, and governments to continue suppressing and controlling this deadly virus.
Zoom can select the language where they can listen.
Working together with the Global Fund, UNICEF, and UNITAID, we have now placed orders for 30 million tests over the next 4 months. The first shipments of these tests will begin next week.
很高兴能在联合国中文日用中文向世卫。
Solidarity flights continue to ship life-saving medical supplies across Africa to protect health workers who are on the front lines in the effort to save lives and slow the pandemic.
I hope this answers the question from Marie.
This is part of the overarching drive to keep supply chains moving and ensure key supplies reach 120 priority countries. Through April and May, we intend to ship almost 180 million surgical masks, 54 million N95 masks, and more than 3 million protective goggles to countries that need them most.
Я хотела спросить не про то, что мы прямо сейчас делаем в отношении.
We would obviously like to thank our colleagues in Taiwan for having shared an interesting report for which we were receiving similar reports from other sources. At no point in the process of communication in this email that's been received was there any reference to human-to-human transmission or any other issue. It was purely requesting relevant information and thanking us in advance for our attention to the matter.
How WHO is seeing the development of this pandemic.
The email we received from Taiwan is to get more clarification on the issue based on China's report. So the report first came from China. That's number one fact, from Wuhan itself. Second, the email from Taiwan, like other entities, was to ask for clarification, nothing else.
Vaccine isn't going to be ready yet, but at a point it will be, and there's going to...
I think initially, with some of these early studies, we see a lower proportion of people with measured antibodies than we were expecting, I think. And it indicates that a lower number of people are actually infected. And so I think before we go too much into detail into what this means, I think we need to have a better understanding of how all of these studies were done and to put these into context over a large number of studies across multiple countries.
Thank you very much for taking my question. I would like to hear WHO's...
We're very good at delivering vaccines in children. As a global health architecture, we're not very good at delivering vaccines in other than children and adults. Secondly, we have to be sure that communities are fully on board. We've seen a lot of problems with vaccine acceptance. So when we look right along the value chain of vaccine development, we're very focused on the product development, and that's very important. But there are whole ranges of things that need to be done downstream to make the use, the scale-up, allocation and use of any product successful in public health terms. And all along the way, we have to keep safety and efficacy in mind.
Be brief and ask only one question. If question